Vitamin D is sometimes called the sunshine vitamin because it's produced in your skin in response to sunlight. Our body produces vitamin D naturally when it's directly exposed to sunlight, but you can also get it through certain foods and supplements to ensure adequate levels in your blood. Vitamin D3, which is the most common form of vitamin D and with the most benefits, has several important functions. Perhaps the most vital of which are regulating the absorption of calcium and phosphorus, and facilitating normal immune system function. Getting a sufficient amount of vitamin D is important for normal growth and development of bones and teeth. In previous videos, we have addressed several topics related to bone health, osteoporosis, and the role of calcium and protein in maintaining healthy bones. In this two-part video series, we'll discuss the importance of vitamin D3 and how its effect can be potentiated with two other components for strengthening our bones. The first component is a mineral that may slow the age-related loss of skeletal muscle mass, which is also a risk factor for osteoporosis, falls, fractures and frailty. We're talking about magnesium. Magnesium is needed to activate vitamin D because most of the catalysts involved in vitamin D metabolism require magnesium. Some studies have shown vitamin D levels in the blood were substantially increased by supplementation with magnesium and vitamin D, compared to that of vitamin D or magnesium alone. It should be noted that while magnesium intake is associated with higher levels of vitamin D, magnesium supplementation alone cannot fully rescue vitamin D deficiencies. This suggests that there is a complex interaction between vitamin D and magnesium that requires further study. Researchers suspect there's another role played by magnesium in bone health, and to explain it we need to talk about calcium. Like we've mentioned in our previous videos, calcium metabolism is very important for bone formation. Supplementation of calcium and vitamin D in clinical trials of older individuals can decrease bone resorption, increase bone density, decrease fractures, and decrease the risk of falling. Its deficiency, however, along with low levels of vitamin D leads to weak bones. This happens in part because when there's little calcium in the blood, the body reacts by producing a hormone that signals the need for calcium, which is taken from bones. Studies found that magnesium can reduce the production of that hormone. Additionally, restoring magnesium levels in patients with magnesium deficiency increased calcium levels naturally, without the need for additional supplementation with calcium. Before we conclude, please don't forget to subscribe to our channel if you're curious about science applied to health issues and hit that bell icon so you receive the notifications every time we upload a new video. In summary, magnesium plays an important role in bone health because it helps to improve vitamin D levels, which aid in the absorption of calcium, and indirectly regulates calcium levels in the bone by reducing the body's signal to use calcium from bones.
Please note this video is our interpretation of scientific papers. It is merely informative and doesn't constitute any form of advice. If you have any health issues or concerns, please contact your physician or licensed health professional.